Okay, welcome back. Welcome back. We are now ready to dive into our third lecture on iridology. And this week, we're going to be talking about, or this time, we're going to talk about pigments and signs, and we're going to talk about um, things to look for in the eye that gives us clues as to what type of health issues might be going on in somebody. So we're going to start with pigments here and decipher what they mean. So when we talk about pigments, we're talking about the different types of coloring that might show up in your client's eyes, right? So here's a list of some of the common colors. Brown, rust colored, dark brown, black, yellow, straw yellow, dirty yellow, orange, fluorescent orange, red, and white. Now, you need to understand that everybody's computer is different. So the coloring may not look the same on your end as it looks on mine. But keep in mind that these are the colors that you need to look for in a client's eyes. And don't overly concern yourself with the way the color shows up on your screen. Okay, just know that that's the color you should be looking for. Okay, so as you can see, I have my arrow here pointing to that orange color around the pupil, right? So we're going to dive into what each of these colors mean, and let's do it. Let's do it. Let's get this party started. Okay, here we go. All right, so look at that eye. It's beautiful. So let's start with straw yellow, the color of straw, like in a field, a straw field. So that is the color straw yellow. If you see this sign, this is interpreted to indicate a tendency for kidney or bladder disorders or infections. It is also seen as a disturbed urinary metabolism, and it's usually found close to the wreath, close to the pupil, right? You don't tend to see this straw yellow color dispersed throughout the eye. It's normally right around the collarette, okay, the pupil. Okay, so if you see this yellow, automatically think kidney or bladder. Okay, kidney and bladder. And then we have this dirty or brownish yellow, right? And this dirty or brownish yellow is interpreted to indicate a tendency for long-term chronic inflammation or a low-grade infection. So this is somebody who's been dealing with inflammation in the body for a long time. Or it could be there's an infection, a low-grade infection, a very new infection in the body. Now, when you see this color at the top of the eye, what you can see there's more of it at the top. It can suggest chronic sinus infection. So if I saw this in a person's eye, I would first ask them about their sinuses because I see there's a lot of dirtyish, brownish yellow up at the top of the eye, right? So that gives you a clue there. Okay, let's jump on. All right. Oh, this eye. Okay. And also understand that these are the things that we can see sometimes without the use of a magnifying glass. When we go further into these classes, we'll talk about what you can see with the iridology camera because it really does change everything as far as what you can see. All right, so let's move on to this color orange. Orange is interpreted to mean a tendency for pancreas or liver disorders. And it's usually pancreas when you see the orange. It's usually the pancreas. Okay. Now, this is just like a regular orange color. Let me show you the next one, which is fluorescent orange, which is different. Let's take a look. All right, so this is more of a fluorescent orange, right? It doesn't have that deep hue color. It's a little brighter. So we call it fluorescent orange. And this is understood to indicate a tendency for gallbladder deficiencies. Gallbladder deficiencies. Again, I don't know what it looks like on your screen, but this is on my screen a fluorescent orange color. Okay, so keep that in mind. And moving right along. Okay, rust pigments. Now this is hard to see, but I tried to get it so you can see the angle at the bottom and see it's like a rust colored, right? It's a rust colored orange, right? And did I skip over? Just 1 second. I did. Okay, so this rust colored orange is interpreted to reveal a tendency for blood sugar disorders and or for hepatic deficiencies, which means liver deficiencies. Okay, and it's more of a rust color. It's not a true orange. It's not fluorescent. It's more of a rust colored. All right, and now let's talk about this yellow lipid deposit in the sclera, the white of the eyes. That's called the sclera. And I'm also going to do a course on sclerology because that really gives you more information as to what somebody is dealing with right now, right? All right, so this yellow lipid deposit, we call it a pinguecula in iridology, pinguecula. This is interpreted to show a disturbed fat metabolism, right? Disturbed fat metabolism. They're having a hard time metabolizing fat. Now, this is another pinguecula, but it's in a, well, let's go back for a second. Okay, so you see that there, that's yellow, and it's in the white of the eyes or the sclera. Let's go to this one. Okay, so now let's look at this brown pigment that's in the white of the eyes, in the sclera. So when you see this brown pigment in this white of the eyes, if it's in a blue eye or a biliary eye, then it means there's a liver disorder. A liver disorder only in the blue or biliary eye. Let's take a look at this one. Now, here we have it in a hematogenic eye, in a brown eye. And these terminology, the terminology that I'm using should be very comfortable for you now. Hematogenic means a brown eye. If you see this brown pigment in a sclera of a brown eye, of a hematogenic eye, it's considered normal, especially when it's very close to the iris. Okay, very close to the iris. Now, if a brown pigment exists farther away from the iris, then it might mean there's something going on with the liver, right? There's a tendency for liver disturbances. But if it's right next to the eye in a brown eye, it is no cause for concern. It is very normal to see that. Okay. So remember that brown pigment in the white only applies to biliary or blue-eyed people. Okay, not brown-eyed people, unless it's far away from the iris. All right, let's look at this black pigment in the iris, right? This is black pigment. This is interpreted to indicate liver disorders and is considered a pretty serious sign, right? If you see this, especially if there are other symptoms, you should have that person see a healthcare provider immediately, somebody that can treat them medically immediately, because there's a very strong possibility there are serious liver disorders going on. Okay, so let's learn some of the specific pigmentation terms. Now, when you become an iridologist, or you're starting to work with other iridologists, we have a language that we have to use to communicate, right? Just like any other profession. So let's learn some of that. The language that you need, the iridology language you need to know. So when we talk about the pigmentation, the word hetero means there's an additional or other than usual color in the eye. Okay, that's hetero. And chromia means color. It's a Greek word that means color. So heterochromia means there's two colors in the eye, an additional color in the eye. And you see this young lady here. Now, this happens a lot, more often than you would think. A person with two different color eyes. We would call that somebody who has heterochromia. Okay. Now, when we talk about specific pigmentation terms, we talk about hypertropic, right? So this means hypertropic sectoral heterochromia. And that means there is the excessive development of color in a section of the eye. So you see all this brown is only in one section of the eye. So that makes it hypertropic sectoral heterochromia. Heterochromia is always going to be a part of it, right? Because we're talking about the color in the eyes, more than one color, unusual color. So this is hypertropic sectoral, meaning the section of the eye, excessive coloring in the eye. That's what it translates to. Okay. Oh, look at that eye. That is just gorgeous. Okay, so central heterochromia is just like it sounds like. It's the color that's in the center of the iris. You can see all of that extra coloring is around the pupil. It's around the pupil. So it's the central part of the eye, the center part of the eye. So this is called central heterochromia. So if you're working with another iridologist or if you hire an assistant like I had, you will train them on these terms. So when you're looking in the eye, you'll have somebody else filling out the chart for you because you're looking in the eye. That's how I found it the least difficult way to do an exam. So I would say, okay, she has orange central heterochromia, or I would say she has brown hypertrophic sectoral chromia, right? Does that make sense? All right. You get the point. I won't drive that home. All right. So now we're going to move along. In the next module, we're going to talk about some of the signs in the iris, right? Now, the color tells you a lot, and that's the first thing you should look at. And then you're going to look at some of the iris signs. It gets a little more difficult to learn the signs, but you got this, we got this, and I will see you in the next section.